Good afternoon. My name is Rachel Silberstein. I'm the education reporter for the Albany Times-Union. I'm here talking about education. Today we have a panel of school officials to talk about back to school plans. It was just a few weeks ago that it seemed impossible that we'd be returning to the classroom at all. But now, COVID-19 rates are at a record low since schools first shut down. And of course, the governor has given schools the green light to reopen in the fall. And so here to talk to me about school officials have been working feverishly to pull together plans that are safe and take into consideration the health and wellness and safety of teachers, students, staff, and their families. Here to talk to me about some of these plans that are coming together is Kaweeda Adams, the superintendent of Albany City Schools. We have Marie Wiles, the superintendent at Guilderland Central School District, Gladys Cruz, the superintendent at Questar 3 BOCES, and Christopher Lauricella, head of school at Albany Academies. Thank you so much for joining me, you guys.
Thank you.
Thank you for having us.
So I guess let's first get into, of course, we learn more every day about how the disease is transmitted, and you have to take that to consideration as the plans evolve. But there's also regulatory changes. The governor holds regular press briefings, and last week we learned that schools had a new requirement of holding more parent forums and publishing easy to find information about contact tracing, testing, and remote learning on the website. Is this something that, I guess we'll start with the public school districts. Is this something that you guys were already had scheduled and lined up for the next month, or is this kind of the heavy lift fitting in these new requirements?
Well, I'll go ahead and start. Kaweeda Adams City School District of Albany. As part of our plan, one of the things that we did a few weeks ago, we did hold our initial parent meetings and forums to lay out what the plan consisted of and go through those details. And we did them at the elementary level, the middle level, and the high school level. And we also held student forums, and we also held our employee forums, which, that included our teachers and support staff. So once the announcement came out, we had already planned this coming week, the week of next week, of having 3 additional teacher and staff forums as well as parent forums. And so we had already thought about with our schools, because we know that it has to get to the school level. The week of the 24th, we were looking at our school sites hosting family forums so that families could hear exactly what was happening at their school, as well as the employees at that particular school. So what we've done is we bumped that calendar up so that those site-based forums are now going to happen next week as well. And so we're just trying to schedule to make sure that we allow those opportunities for the 3 district-wide forums at the elementary, middle, and high school level for parents, and then separate forums for faculty and staff. And then our schools will host their individual forums while we have a district-wide approach to what that reopening looks like. There may be unique adjustments at the individual schools and parents wanting to know more about scheduling and things like that. So that's where we will have the individual school sites doing their forums next week as well.
Gotcha. Marie, is that what's similar to what's happening at Guilderland?
We had also offered some opportunities to engage with our families prior to the governor's announcement, and had planned to do some additional ones. So we really just had to look at our scheduling to get all of them in by the 21st. So we have 3 sessions scheduled for next week, Tuesday and Thursday evening, and then Wednesday morning. We're trying to pick times that will meet parents' flexible schedules. And then we have a faculty and staff forum on Wednesday afternoon. But throughout the summer, our building principals have been holding voluntary faculty meetings, and they've been getting tremendous turnout because there's so much hunger for answers that, communicating is huge. Unfortunately, we have more questions than answers most of the time. But as we work through the summer, we're getting better. We're pulling things together.
I know the governor keeps mentioning public school districts, but are charter schools and independent schools, are they also required to do these forums in the next month?
That's our understanding, Rachel. And you know, we have the privilege of being scaled differently. We have the privilege of being a single site. So you know, we don't have all the constraints that our public school colleagues have in terms of just the number of constituents and stakeholders that they serve. So we've probably already met and exceeded the threshold that the governor put out on Friday. We had our parents actually review the plan that we came up with online, leave comments, and then we did a series. We're up to about four webinars now that we've already done with parents. Same as Guilderland, our teachers have been in voluntarily all summer. And yesterday they actually started taking the plan apart, and the same thing. Our faculty, because they have to deliver on the plan, ask really good, granular, classroom-based questions that administrators may not think of. And so we're just in this open dialogue about each question leading to 3 or 4 more questions that we have to figure out. And they've been incredible, our faculty have, in terms of helping us refine the plan. And our parents too, remembering that they also pay a tuition, not just enroll. We need to meet not just what the state is asking of us, but what our community is asking, who's paying a tuition to come to the school.
Gladys, you have more of a regional perspective. I know that superintendents have regional meetings regularly. Has these new sort of last minute requirements put additional burden on school districts as a whole, or is this something they are used to rolling with the punches with?
So for our BOCES, I'll start with our BOCES. So I have been holding a virtual town halls for staff members since March, since the pandemic started. And these have been very well attended. And we've been able to get a lot of their questions, but answer a lot of the questions as well. And then we've also been holding parent forums, virtual parent forums with the last month. So we had already been in that groove, and the same thing with our districts. Our districts have been hosting staff and parent forums. So it was a matter of ensuring that we could comply with the 3 forums for parents before August 21st and the additional forum for the staff. But in our case, we have definitely met many more times than the governor's request.
The other thing he talked about, which I think caused a little bit of confusion, was requiring schools to post how they will conduct COVID testing on their websites. And I know that at least around here, most schools are relying on county health officials to make some of those calls because they have the expertise and they understand, you know, epidemiology and how it works. Can we talk about like exactly what happens? Are schools figuring out sort of the granular details about what happens when a child arrives at school, is symptomatic? Are they immediately isolated? Who makes all those calls about whether there's contact tracing, whether a school closes down, and whether testing is necessary? Kaweeda, do you want to start with?
Yes. So one of the things that we look at, first of all, is if a student arrives to school and they have symptoms, then we immediately look at isolating that student and then contacting the parent to pick up the student. And so each of our sites have an isolation area, and we have the PPE for our healthcare providers that are at the school, meaning our school nurses. So that piece we would look at. We then contact our medical director, and then our medical director, Dr. Laura Staff, will then be in contact with the health department. The health department will then work with our medical director to look at the contact tracing, who are the people that have been in contact, et cetera. And then as it stands now, based on their guidance, they are responsible for that contact tracing, and they contact, whomever needs to be involved with that. In terms of notification, we are guided by the Department of Health in Albany County with regard to that notification. Typically what we have done in the past is we have notified if there's contact that is directly involved at the school level, we will contact the families of those students in that classroom. We will notify that school community that this is the case. And then I keep the board informed with kind of a summary information of here's where we stand as a district as a whole with X number of positive cases, making sure that we follow that protocol as established by the Department of Health. The student, based on, they will be referred to testing. And then what we have done is we have handled that absence as getting makeup work for the child. And as we move forward, it would be a virtual environment where the student would, while they are out, would be engaged in a virtual environment.
Have any decisions been made about under what circumstances the school would need to close? Or are these cohorts siloed enough that you can just notify students in the cohort?
So again, for Albany County, we get the advice from them with regard to whether it is recommended that we close or we are directed to close or not. We have been given guidance by the governor that when I look at the district or schools will close if the regional infection rate is over 9%, we are looking at those particular guidelines. And so one of the other pieces, though, at a more local level, the school level, our school administrators will absolutely be on top of the attendance rates at their school and why students, for those students who have selected or those families who have selected in person, looking at the attendance rates. And if they're noticing that, a number of the students are out and here are the symptoms and these are the things that we're concerned with, we have to then take that information, excuse me, and discuss that with the health department and engage our district doctor so that we are engaging all of the minds, the medical director, the Department of Health. Here's what we're seeing at an individual school. And then in consultation with the health department, those decisions will be made based on whether that individual school needs to be closed, if it's an individual classroom. Those guidelines, the Department of Health works with us on that.
So, okay, I guess.
And again, I'm speaking for Albany County.
Gotcha. Which, I know Guilderland is also in Albany County.
Yes.
Under what circumstances? I know the teachers union is asking for if there's one positive case, then the entire school building should shut down. Is that reasonable? Is that practical? Or is that something, under what circumstances would a school building shut down?
I'll jump in here, and I think this is I think the answer is it depends. Because of the way we're structuring our classrooms and we are cohorting students and we are trying to isolate groups of students, it's really going to depend on the extent to which an individual came in contact widely across the building. And we won't know that ahead of time. So that's it. I've heard, for example, that this is more of a summer camp kind of thing, but there was a local camp who had a positive case, but because they had clustered the children in small groups, that when they had that positive case, the one group was, kept home, but the camp remained open for the other children. And so I think there's going to be some variation of that within our school buildings, depending on the size of the building, the structure of the building, the extent to which there is contact among individuals who may have been with that individual, with the affected individual.
So I guess on a regional level, talking from the BOCES perspective, do you think the county health departments are going to be a little overwhelmed when schools return to the classroom? Do they have the staff to do contact tracing on such a large scale?
So we have had meetings with the health department as well every week. And just yesterday, we actually met individually with each of the health departments. We will be playing a role in helping them with that contact tracing. We have to keep good records, right? Maria's talking about keeping students in pods in smaller in groups so that we know who's with who, and we will need to have that information available and be able to coordinate with the health departments in terms of who a student came in contact with in the event that a student is tested and is positive for COVID-19. In our case, we will be working directly with we have termed our COVID-19 coordinator, and he is the health and safety director for our BOCES. He works with all of our districts, and he works very closely with the local health departments.
Okay. Chris, is that similar to what you guys are?
Yeah, again, it's we are blessed with a different scale. So the only thing I would add to the discussion, all of which sort of lines up with what we're planning, we are following the DOH recommendation to at least try to do the home-based symptom survey monitoring in the morning before students even get to school who are symptomatic, and we're using an app-based program to do that. So all of our parents will have an app. They're meant to ask the questions, take the temperature check in the morning, and then put all of that into the survey app that would then let us know on the school side if a student can come to school or not come to school. And then we've got systems in place that filter whether or not the student and family actually filled out the survey. Do they need to be temperature checked as they walk in? And then those are the rest of the pieces. And the only other thing I would say we've added, we've gotten a fair number of our staff and faculty trained as contact tracers, and not to do the contact tracing, but to understand when they are working with the Department of Health, what they need, both from the ethics of contact tracing, the HIPAA laws, and also all the record keeping that goes into that. So, our hope would be that we would have done all the pre-work for them if they are overwhelmed or if they do have staffing issues, that by the time they get to us, or when they get to us as quickly as they can, we can hand over to them what they need to quickly, understand whether it's a primary or secondary case and what the community spread might look like within one of our buildings.
So in the interim though, are there do you just veer on the side of caution? Is it just isolate?
Yeah, it's an isolate, go home, contact your physician, contact the DOH. You can't come back until you've done all of those pieces. And, the piece that we haven't covered, but I'm sure we will, is that the CDC list of symptoms is a broad list of symptoms that overlap with just about every other childhood illness and malady. And so that's going to be one of those very interesting things, I think, for all schools. If I'm showing one of those symptoms, and our conversations with the DOH, who have been fabulous with us, is yes, if a child has a symptom, they are meant to be kept out until they're screened for COVID or non-COVID illness. So there's going to be
that's another challenge, I think, for public schools, which are taking students' temperature at the door. Some of these symptoms are pretty ubiquitous among small children. So is the fear that there might be, do you have enough isolation rooms to accommodate that much ambiguity? How do you parse, normal first day of school jitters from a real symptom?
Well, at least initially, our nurses are going to have to be able to make some initial judgments, which is what they're good at doing. Although we're not expecting our nurses to make diagnoses of COVID-19, but to really weigh what are they assessing. But I think we will err on the side of caution if students have symptoms to send them home and have them get checked out.
I think it's also important to note that that initial attestation that we are asking families to do is extremely important. And then if it's not able to be done at home, then when they do get to school, that perhaps there may be some type of system where if we know that this parent was unable to do that, do we have a kiosk set up at our schools where it can be done prior to getting to a classroom? We have secured touchless thermometers, so we are looking at taking the temperature of our students, and I know most schools have done that as well. Those are the things that we can do to try and stay and be proactive. But in those cases where something else happens during the day, we still have to be prepared for that. And I think that's what's important to note, that the precautionary measures are in place. It's those things that are concerning people when something happens outside of what we have planned and what the responses are and what that normal flow would be. It's what happens when. I mean, I know we get a lot of questions about what if, and I know the other superintendents and school leaders are getting those same questions. Those questions, we have to be able to answer those on a case-by-case situation, but for us to at least be able to have a structure in place to start is absolutely important. And I think that's what our reopening plans have done. They've given us the floor. They've given us that foundation of here's where we start. Now, based on whatever scenario comes, we're going to take what we know and apply that to what is different or what is unique.
I think what's also important, if I can add, is that since we're having all of these parent forums, that we communicate to the parents that this is a partnership and we have to work together to curb this pandemic. And if you have your child who is not, who is ill, please keep them home.
Yeah.
You know, they have a fever, or if you feel them, they're off, and parents know their children very well. You know, we need the parents to understand that they need to keep their children home when they're ill.
I can't agree more. Just just to emphasize that for all the school leaders, this is not the year to dose your child with Tylenol and send them to school and have that wear off halfway through the day. It's going to be too scary for your little one if you do that.
Yeah, that makes a lot of sense. So I just want to break for a second and tell people who are watching that if you have any questions for these school leaders, you know, submit them on Facebook, Twitter, YouTube, and they will get to us. And I think that leads us into my next question, which was, you know, regarding contact tracing. I know a lot of public schools are front loading their professional days and maybe starting school a week late so that they can train a lot of their staff in some of these new protocol, like contact tracing and screening for, you know, health and you know, PPE and protection and all that stuff. Can you talk a little bit about, you know, what kind of training you have to do ahead of the fall school year?
Well, you just named a lot of them.
Okay.
So when our faculty return, we're going to set aside some time to do that kind of training, but we're also going to spend some of our time doing techniques around successful remote learning. Right. And you know, those kinds of nuts and bolts things to help them be more comfortable with working in multiple environments, because I think all of our plans have, you know, hybrids and in-person and remote. It's a lot to ask of our faculty. So that will also be a big part of our beginning of school training opportunities.
Do you want to weigh in, Kaweeda, on the training, the preparation that has to go into, you know, the days before school starts?
Absolutely, it's much of the same. We are absolutely looking at pulling forward our professional development days to the beginning of the year so that we can get that training done. Because of our different models, we may have to use some of our middle schools to house our elementary schools. So we absolutely need to make sure that we build in some orientation time in our instructional day so that when we do come back, students can get acclimated, but also teachers can get acclimated to perhaps a different learning space. Much of that will be contingent upon the results that we get from our feedback forums and things like that we are doing right now, but also we have a survey out so that we can see what do we need to do in terms of virtual learning versus in-person learning. I agree with Marie, along with those, I call it the compliance of procedure items that we need to do. How are we entering the building? How are we exiting the building? Do we have the one way in, one way out, hallways one way, etc.? All of those components, the proper hygiene that we need to make sure that we are doing with our students. How are we allowing time for washing hands and meal time, and what all of those things are interconnected. And so it's basically allowing the time for people to understand what the procedures are when you're in the environment and get comfortable with that as adults, then including that instructional component. And now, how do we, in a phased in approach, look at bringing our students back into that environment, which is going to be very different from what they're accustomed to. How do we help our students adjust to wearing masks for the majority of the day? Do we have a sequential plan? And these are all questions that I'm not going to say that I have the answers for, but I'm saying these are the questions that we are asking in our groups with how are we going to get our six-year-olds adjusted to wearing a mask for X amount of time during the day. And what does that look like, you know, and how are we working with families to help them understand that that's a significant, important piece of what we're looking at for this coming school year. All of those questions have to be answered. We have to have that guidance that goes out to our families, and then doing it in multiple mediums.
Chris, how's Albany Academies handling the training side?
I would say it's everything that you've just heard and we've just spoken about. I think the only other pieces that we're thinking deeply about, and I'm sure everybody is, we just haven't hit it yet, are the mental health aspects of this. So really thinking about both the self-care of our professional community, so that, you know, we're all going to start off in September and work probably, as you've said, the hardest we've ever worked in our life, but we need to endure all the way through the year, whatever the year is going to bring. So how do we do that with the adult community? And then we know that our kids are going to come back to school, and our practices have to be trauma informed. I mean, there's a lot that's gone on since we've closed schools in March that from the mental health side of things, we're going to have to work through, in addition to all the health and hygiene and all the physical pieces, to create a community and to create a supportive community when we're not all together in the same place. So it really is it's a tall order, but we're also thinking about that from a mental health perspective.
For sure. Gladys, could you tell me about, like, I know some schools are choosing to start school late. Some of them are starting on time, and, you know, some are requiring masks full time. Some are requiring masks some of the time. I think the biggest challenge for school leaders is that parents are always like, what about them? They're doing something different. Can you talk about why there's like little distinctions between local schools?
I think part of those differences have to do with the local communities and what, you know, that come out and the conversations that they're having with their staff and with their parents, and, you know, the decisions that come out of those conversations. So yes, we have anything from delay, you know, start remote and then a delay in person, to some grades in person from the beginning, to everybody in a virtual and in-person setting. So we have everything in our region. And, you know, the delay, as everybody has said, is to try to get some of that staff development. A lot of mandated trainings have to take place in the beginning of the school year. And then the new trainings that are related to COVID-19. You know, we have a bunch of trainings that have to take place, like SAVE and things like that. And then in addition to, now we have to do all of these. So in our BOCES, we did a online training to return to work. So as you know, everybody was out, people started returning. We did a slow return, so 50% capacity at our offices and buildings. And before people could return, they had to complete an online training. Talked about the COVID-19 virus. It talked about how you wear a mask and how, you know, all of the, how you has hygiene, all of those things that everybody has talked about. So we believe that the delay in the start and bringing the professional learning days at the beginning is the most sensible thing to do given our reality.
We actually have a bunch of questions that are coming in. One of them was going to be my next question anyway. The question was, when will remote families get an idea of what the daily schedule will look like? We need to plan. What will a typical day look like for teachers teaching both the in-person kids and the remote kids, et cetera? Kaweeda, do you want to start with that? I know that you guys surveyed your parents recently and found that 60% are interested in the fully remote option.
We're working on what those schedules might look like. We have the overarching schedule, but at this time, as we gather more information, that's where over the next few weeks, we're going to be looking at, you know, who are the teachers who are teaching in person, who are the teachers that are, quote, the virtual teachers. What is that going to look like in terms of a schedule? Because there's so many pieces to the puzzle with regard to staff that may have medical considerations that we have to develop plans for them. we don't know exactly where teachers are going to be placed. And so one of the big questions that we've had is, you know, what teacher will I have? Will I have this teacher? Because at my school, students roll up with their teacher. Well, we have to look at what, there may be a medical concern that we have to address. And that information, we're gathering that this week and over the next week. And then we'll be able to put together some schedules, I would say in the next few weeks, so that families will know. But one of the things that we are trying to do is get that overarching schedule developed so that parents at least know if we're doing a phased entrance, what does that look like? We'll be talking with our board about what some of our options are and how we may need to make some adjustments to the plans that we've submitted, which we knew that would happen as we gathered that information. But I would say over the next few weeks, we should have information out about the schedules.
And I guess moving on to the child's experience, Marie, do you want to jump in about like how, I know last year schools had to pull together some remote learning infrastructure on the fly, but now at least there's been like a full summer to plan for this. How will remote learning be different this year than it was in the spring?
Well, I think you're absolutely right. We did just jump into remote learning without any opportunity to prepare. So on one hand, we also had now March, April, May, and June to really develop our skills around remote learning. So it was, baptism by fire for many, but we have, I think, really developed some good tools and some good skills in order to make learning online engaging. But some of the things that will be different, we were looking at creating more clear schedules of how students will spend their time. So it's more consistent across classrooms, across grade levels, across buildings. So that will be one part that will be different. We will be taking strict attendance. That was very hard to do under the kind of impromptu rush to remote. And then one of the other main differences, last year we opted to move away from grading of student work. So we had instead moved to kind of a student would have demonstrated evidence of learning,
right,
or they did not demonstrate evidence of learning.
Right.
So that did take some of the pressure off on one level, but it also, for some students, took away some of the motivation to do their best work. So in our returns, student work will be graded. There will be expectations for full participation.
Is that across the board? Or are we going back to traditional grading? Should students expect to be accountable for remote assignments they don't turn in?
Yes.
Okay.
Absolutely.
Yes, Chris, everyone.
We went away from grading. It was, we graded even when we were in remote learning for those very reasons.
Yeah, that makes sense. I guess another question that's coming in is, educators are scared and concerned about returning to in-person instruction. What resources and materials are available for teachers to protect teachers and students? So I guess this question more relates to like, are there going to be masks and PPE available for anyone to use on demand?
Yes, the BOCES is providing masks and to all students and all staff if they need it. And if a student doesn't bring his or her mask, there will be one to give to them in the morning. Same with adults. The staff that need that extra PPE, everything will be provided by the system. And it's the same thing across our region and all of our districts.
We talked about grading, but what about standardized tests? I know the state relaxed a lot of those requirements. Are we going back to those standards, standardized tests and having the same expectations? Or we don't know yet, that's sort of up in the air?
We don't know yet. Last year, the federal government provided states the possibility of a waiver regarding those assessments, but I think it's too early to make that decision in terms of the federal government hasn't made that decision yet.
Okay. Will the screening, Alex James from YouTube wants to know, will the screening app for families be in languages other than English for the diverse population?
Yes, we do have in the City School District of Albany, we are able to provide the translation service so that it will be available in different languages. We are working, there's one language that we are working with getting everything done now. Everything else is taken care of, but we have one language that it's a little difficult for that transition, that translation, but we're working to get that taken care of by the time school starts. I do want to circle back to the question about PPE. In Albany, one of the things that we're doing that's a little different is that we are asking families those families that can, to have a mask for their child, because some may want to do reusables, some may want to do replacement masks. And then we as a district, we are working to get those replacement masks should a student come without a mask or should they need one. We are doing it that way because we've already asked, and we will continue to ask our families to provide the first one or provide the mask up front, but still knowing that we will have a supply of replacement masks, or if a student comes to school and they don't have a mask or a family notifies us, we should be able to accommodate them.
That makes sense. I guess, could we talk a little bit, since we're talking about masks, could we talk about, we're learning more and more about how it's transmitted, and we know children are largely asymptomatic. In terms of like airborne transmission, I know there's been a lot of talk about updating filters in school buildings. Is this something that's practically something schools can do? Is it feasible financially? I know there's like the filters, there's the UV lights, there's like various, technologies people are floating to keep the air clean, and also making use of outdoor space. Chris, I know you guys have set up some tents outside if you want to start.
Yeah, I guess there's a couple of things. So and we, again, this is our scale and size and being an independent school. Going back to masks, we've made the decision that all students must wear masks at all times on campus with limited exceptions, which is a little bit more extreme than what the guidelines provide that we can do. And we've done that partly because we know so many young students are asymptomatic, and partly because that's what our community is telling us that they really want us to do. And of course, no community is monolithic. So we've got parents of young learners saying, there's no way my 5-year-old can be in a mask all day. But we're wrapping up 3 weeks of summer camp, which tells us differently that actually our youngest learners had no problem adapting to the mask, and were our most highly compliant students on campus with that. So well, that's the process, right? So we're learning things we've never learned before by doing them. So that's the mask side. On the ventilation side of things, we've got legacy buildings going back to 1930. So, we have a radiant heating system, a big old cast iron boiler. We don't have an HVAC system. Anything that has an HVAC system, we've done the MERV filters and all of that. But what we have done is put fans in every classroom that can do outside air exchange. We've rented tents, and so we've got tents up. We've 52 acres, so we've got tents up and are going up around the campus. And that'll be great until the weather turns, and we'll be using those as outdoor spaces for students. It's actually how we're collecting students in the morning as well before we let them into the building. And now we're trying to think about, well, what happens in November, December, and what do we need to put inside the buildings for that? And then anything that doesn't have an exterior window that can use an exchange fan, we're doing air purifiers and putting those in place.
All right, I guess let's hear from the public school administrators. Like, how are you guys handling sort of the air purity component?
Well, we're looking at the filters as well. I know there was the kind of the gold standard was MERV 13, but our engineers tell us that those are actually so fine that our equipment won't work with them.
Wow.
So the most we could go is MERV 11 in our classrooms and 9 in our bigger spaces. So we're looking into doing that. We replace our filters every year anyway, which are typically 8. So we're well on our way, down that road. Yes, on fans, opening windows. Currently, we have an enormous tent outside one of our elementary buildings where we've done several of our summer school classes, and we're looking at the potential of adding tents, but they are a short-term solution in the Northeast. So we're looking at that as well. You know, it's a very important topic. We get tons and tons of questions about it. And I know more about air filtration now than I ever did before.
Some of these air filtration systems are sort of counter to like energy efficiency technologies, right? I know Albany City Schools has a brand new building with all these energy efficiencies. How does that work with the technology?
So it does work with technology, and what it does is it brings in the fresh air. That fresh air cycle comes through at a higher rate, and it comes through more frequently. So that's one of the things that we've looked at the new building. But just throughout, number one, we did a check to make sure that all of our filtration systems do meet the state education guidelines, and so we are comfortable with that. But we are still working with our architects and our engineers and our facilities department to see if there are other things that we could do, additional steps that need to be taken with regard to filtration. We do look at outdoor learning spaces, but that is also because some of our buildings, there's very little green space for some of our buildings. So that outdoor learning space is going to be a site-based decision where the individual administrators would have to work through. That's one of those things where at the site-based meetings, our principals can discuss that, because based on where the school is located, you know, if they're landlocked with very little green space, that's going to limit some of the opportunities for that outdoor learning space. And then we do have an annual replacement cycle of our filters. And so we're looking at replacing them more frequently, just so that we can make sure that the air is being filtered properly.
Is this a huge expense for school districts, would you say? Is this, you know?
It's an unplanned expense. So it's not something that was planned for. And so, and I know that as we get to talking about what some of the limitations are, what happens right now is we've all passed, you know, those of us who have passed our budgets are in place. But now what we need to do is start looking at where we can reallocate funds to cover some of this. And yes, we have the reimbursement plans, we have the CARES Act, we have those things, but right now, you have to have the money right now. Yeah. And so what that means is you're looking at your budgets daily to see what can I move from this pot to cover this particular cost. And then you're strategically planning that should those reimbursements come in, you know exactly where you have to start putting those funds back.
I mean, has the federal government committed the funds that schools need, or we're still asking for it?
We're asking the federal government for funds for both schools and for counties, right?
Yeah.
I think where, you know, the issue we have with the budgeting is that all of this stuff costs money and it wasn't planned for. So masks, all this additional PPE, all these additional disinfectants and cleaners, all, you know, having more staff to ensure that they're, you know, ongoing cleaning, high touch areas, all of those things together cost more money. And districts had, you know, we approved our budgets prior to having, you know, knowing that we're going to be spending all this additional money on additional expenses.
One of our readers wants to know who's supplying all the cleaning supplies. Last year, my kid's kindergarten room had no soap for 3 days. How are we making sure that never happens? How do we know that the cleaning products are up to standards? Is there sort of a standard for cleaning products?
The state education department puts out standards and we have to follow those protocols.
Gotcha.
And I'm going to say that we have been, if you remember, the governor's office was, they had the sanitizer and everything available that schools could go and pick up, and we routinely go and get what is available. So those are things that we are doing to make sure that we don't run out. I would say the other thing that I know, not just our school district, but I know other school districts and schools as well. Sometimes when you're ordering from a company, there's a limit because this is a nationwide pandemic. It's not just one school district ordering masks. You have every school district in the country ordering the same materials. And so some of the companies, some of our vendors, they have a limit as to how much they will allow you to purchase at any one time. And so what you have to do is get in the queue. You have to make sure that you're in that queue and in that cycle of every 2 weeks, we are ordering X, Y, and Z so that we can maintain our 90-day supply of masks, our 90-day supply of sanitizer. So that way, as you are going through every 2 weeks, you're ordering that maximum limit that you can so that you can make sure that you don't run out. And it's really putting that trust in the vendors that they will be able to fulfill the supplies.
That's kind of nerve-wracking, not knowing, once sort of the crunch happens and all the schools are going to be needing these materials, whether suppliers will be able to keep up.
That's
There are
true
some
with
suppliers
technology.
right now.
I was just going to say that's true with technology as well, as we're trying to do much more remote instruction. Many of the devices that we've ordered, I know this isn't the health and safety piece, are, on back order, even though we've ordered them months ago. So there's a lot of supply chain challenges.
Like Chromebooks and stuff? Are we talking about Chromebooks and laptops?
Chromebooks, laptops, iPads, hotspots, all of it.
It drives into your decision making. So in normal times, you don't have to worry about supply issues when you're making a decision. You purchase what is the best thing for your organization. Now there's an added layer of maybe it's not the best, but is it available, and will it be available when I need it? And so it's a whole other layer of decision tree and decision making that we have as school leaders.
Wow. I guess that leads us to, as we wrap up, like, what are some of the regulations that still need to be adjusted? What are some of the funding challenges? And of course, the supply and demand is obviously a big one. Is there anything else that you guys really hurdles that need to be cleared before schools can reopen?
Transportation is going to be a big unknown.
We can talk about that.
Particularly for non-public schools. So we're served by, 8 different districts across a region. Right. And so we're sort of what is each district doing? How are they doing that? I'm sure they're going to figure it out. They've been great partners to us, but in the conversations that we're having around how transportation is going to work, particularly busing, there's a lot of moving parts and they're still trying to figure that piece out. So for us, that's going to be interesting. And then for me anyway, there's this tension between an ask to do COVID testing, which is in tension with this overly broad CDC guidelines for symptoms. And yet when you really try to figure out what COVID testing looks like for schools, it's untenable. Yet we keep having this conversation coming back about, will you test kids coming back to pre-K through 12? And, from my point of view, until there are low cost, fast point of care tests like the Sherlock test or a paper strip test, we're not going to be able to do that. And yet our stakeholders really want us to do that. And they see that happening at the higher ed level. So, there's a whole tension there.
I think a lot of the colleges had, arrangements with local labs that which then outsourced their services to other states that were having much higher demand. And so they lost that.
Yeah.
Some universities even have their own labs though. If they're a research institution, they may even have their own labs. And public schools and your K-12 organizations, private schools, charter schools may not have that.
Yeah, especially if they have a medical facility, but even that's pretty rare. So I guess, is there anything else in terms of hurdles, roadblocks, challenges that schools are still working through? One thing that, speaking of transportation, we'll come back to it. Transportation is something that keeps coming up. The bus drivers I know are very concerned about what kind of protections are in place for them. The state's not that clear. It hasn't really laid out about air purity on the buses. I know they're being filled at half capacity, but students are getting screened for symptoms at school, not before they get on the bus. And so that has some people concerned. What is sort of the current plan that's taking shape for transportation?
Well, I'll jump in here because it is a big part of the plan. So we actually reached out to families to say, do you plan to take transportation? So we could adjust our capacity levels. our families will be doing their screening before children leave home. We're doing one of those home apps, and depending on our families to gather that data. So presumably students will get on the buses having completed a procedure to say that they don't have any symptoms, they don't have a temperature. And then on the bus, it's one child per seat. So right now, because of the numbers of families who have opted to drive their children to school, which will create a whole other traffic jam at each of our buildings, we do actually have good capacity where we can maintain, not 6 foot distance on the school buses, but that one child per seat, everyone wears a mask. But it is a challenge.
I know Albany, you guys.
We're seeing the same thing. We're seeing the same thing.
I know Albany found that like 60% of parents are choosing the fully remote option, at least the first survey of like, a certain number of respondents said that that's what they're interested in. Is that the breakdown that you guys are all finding, that like more than half of your parents are saying they're going to keep their kids home?
We're at about 20% are doing remote.
Okay.
That's the average in our BOCES region as well, about 20%.
Gotcha. All right. I guess we're running out of, let's see, there's one more question. For students that are in special education classes and may have underlying health conditions, how does the district plan to address that particular need? Because I know, okay, so for background, students are, school districts are prioritizing special ed classes for in-person learning because they need that additional support. But then if they have an underlying health condition, how will they get that support? Because they can't be in the classroom.
Well, students can still, even though we're prioritizing that for in-person, they can still opt for remote, and we would provide all of their special education services remotely.
And that would be the same.
Okay. And I guess like just I know school superintendents, they keep telling me this is like the hardest they've ever worked in their careers. It's been like nonstop meetings and Zoom conferences. Can you tell me about like how it's been for you, like making these, like with everything changing every day and making these life and death decisions on a daily basis? Chris, do you want to start?
Yeah, it's the best I've heard it described is, well, there's two things. It's like being on a roller coaster, and it's also like signing up for a marathon, but you're not really sure when the marathon ends, and you didn't really agree to sign up for the marathon. You just happen to find yourself in it. So those two sort of things. And it is sort of becoming expert in esoterica that you never thought you'd have to become expert in. Everybody is looking for some sort of certainty, surety, or some sort of authority that will help them through this for their family. It's the most important thing they do is raise their children. And there's a burden to that. There's a weight to that. When you become that point person for your community. I would say the only other thing, and this is just an observation. When I go to look for somebody outside of my school who are the authorities, it's such a stew out there that it's hard to figure out, what is real and what is not real, and what is information and that is valuable. So it's just a very interesting time, and that's what we do. We're educators, so we're used to sort of having a right answer. There is no right answer right now, and the answer I give you today is going to change tomorrow.
Marie, is that you're telling me about how it's been going for you?
I compare it to cross-country skiing, and under normal times you have a groomed path, and sometimes there's an obstacle in it that you have to work around. But now there's no groomed path. It's all uphill. There's lots of ice. It's a whiteout, and there's a cliff, but you're not quite sure where the cliff is. And everybody is following you and depending on you. That's how I think about it.
It's a good analogy. Kaweeda, how's your summer going?
Our summer has been very busy. I am very fortunate, and I know just as other superintendents and school leaders, to have an amazing team that we work alongside each and every day. The capacity of the people in our organization it's really unlimited, and it's really challenged us to, number one, think more deeply about the work that we do, and then understand that when we're getting the questions and when people are, angst and amped about different things that are happening, it comes from that place of the uncertainty in their own lives, and they're looking for that certainty. And as school districts and as schools, we have been able to be that source of stability in our communities. Because no matter what happens, you knew that your kids were going to go to school, you knew they would go whatever the time is, 8 to 3 proverbially, you knew that was going to be the case. Now we don't. And so that uncertainty that our families are feeling is because of the uncertainty in their own lives, but also the thing that has been stable for them is also uncertain. And so, as Chris said, we're used to having the answers. We're used to routinely opening our schools. We have food deliveries. We have food services available for our kids. We have transportation available for our kids. There are a lot of things that were, I'm not going to say taken for granted, but just were part of that expectation that were not worries, whereas now they are. And so understanding that, I think, has helped us think a little bit more deeply about what we do. But also, I will say that one of the pieces, whether it's positive, negative, or indifferent, the level of engagement of our community has increased substantially. We are hearing from our communities, and again, I'll say from our families, whether it's positive, negative, or indifferent, we are at least hearing from our families. And that way, we are able to make decisions based on their feedback, based on the data, knowing that all of us are thinking about this in the best interest for our students. We may come from a different lens. We may think that things need to be done a different way, but at the core of it, we are all looking to do the best thing for our children.
And hopefully, education in New York will be even better than before the pandemic, given that we have all those new tools. I mean, what are you guys' thoughts? Do you think that this has sort of transformed education as we know it?
Well, one thing we can say, and I would say, is that we can't go back to what we had.
Yeah.
And we've been able to use technology in ways that we never thought we would use technology. Right now, you're having this panel using technology. We for many years have tried to integrate technology into the classrooms. Now we have learned that it can be done. It's not perfect. It's hard, but it can be done. And there are children actually that we learned that are very successful in this mode. So I think we can't go back and just dismiss the technology we have been using. We have been able to collaborate much more through the technology. We don't have to run to meetings. We can do it right from our offices. I think we need to embrace those things we learned during this time and move forward to a new reality.
All right.
Great challenge brings great opportunity. And we're learning from this. We learn every single day, and I think that's a good thing.
All right. Well, thank you so much, you guys, for joining me. We'll end on that positive note. If you guys have any more questions, you can send them our way. And, thank you so much for joining me.
Thank you.
Thank you very much. Have a great day.
Have a great day.